on Nation to Nation, Cindy Blackstock says despite reports of illegitimate Jordan's Principle requests being processed, the majority of claims are valid.
By the vast majority of the situations we're seeing, these are legitimate requests from families, children, and nations.
With federal funding for the Inuit Child First Initiative set to expire in a matter of weeks, Nunavut NDP MP Lori Idlout is raising alarm bells about what this could mean for families in her riding.
They're quite scared about what's going to happen if this funding ceases to exist.
In spite of pushback from industry and government, Patrick Brazo says the day will come when alcohol products contain warning labels of cancer risks.
I'm going to say a safe bet here and say it's no longer a question of if we will have cancer warning labels, it's a question of when.
Welcome to Nation to Nation. I'm Fraser Needham. The federal government and child advocacy groups continue to battle it out over the application and processing of Jordan's Principle requests. The federal government admits it has a backlog of about 140,000 requests, but it recently launched a legal challenge of a Canadian Human Rights Tribunal order, which requires the feds to immediately address this backlog. Joining us today to talk about it all is First Nations Child and Family Caring Society Executive Director Cindy Blackstock. Welcome back to Nation to Nation, Cindy.
Thanks very much for having me.
So let's start off, I guess, first with this, the latest, which is early, I think in early January, the federal government launched this legal challenge of the tribunal order. Have you been able to gain any understanding of what the legal challenge is about?
No, they'll just say things like complex legal issues, kind of leaving it up in the air. But the tribunal has just released the full decisions or full reasons for their decision that they made in October. So that we expect that the feds will provide more precision. We would hope that they provide more precision about why they're challenging the order. We would rather see them actually get down to work and actually solve the problem for kids. And in fact, that's what the Chiefs in Assembly also directed them to do, is stop the legal challenges and just do the right thing.
All right, I'm going to move to another issue that also cropped up recently, and that's Jordan Anderson's father went public with complaints that he feels Jordan's Principle is being misused and damaging the legacy of his son. Is there perhaps a misunderstanding of what Jordan's Principle should entail by maybe both First Nations and the government?
Well, one of the things the government has not been doing consistently across the country is really respecting that in order to access Jordan's Principle, you need a professional letter or a letter by an elder or knowledge keeper who's authorized by that community. And so in some cases, that lack of due diligence on behalf of Canada led to a bit of slippage. But by the vast majority of the situations we're seeing, these are legitimate requests from families, children, and nations that need to be filled. And where there are any kind of misuse, I think that could be addressed by Canada simply following the professional letter. That's the safeguard.
All right, fair enough. And of this backlog of requests, there's roughly 40,000, I think, that the government itself has deemed as urgent. Have you seen any movement in recent months to really address these urgent requests, because they need to be addressed urgently, I guess?
Yeah, like we're talking about, kids with medical needs or kids with mental wellness needs or other types of services that are essential for that child. And we're not seeing a lot of progress, frankly, on reducing that urgent backlog. We're hearing some more discussion by the federal government, but they were ordered back on December 10th to immediately address it. And that's been slow to come. So we really need the advocacy of First Nations, the continued advocacy of First Nations with the government to make sure that they actually follow the legal orders and that they address these urgent needs for kids.
Right, and on that note, I guess I'll move to the Assembly of First Nations. Of course, originally stood side by side with the Caring Society and the initial complaint that I believe led to the creation of Jordan's Principle when you had brought it to the CHRT. But now the AFN is kind of in a bit of a different situation. It's chosen to stand apart from both the government and the Caring Society on these backlog of requests. Is that creating a problem in terms of advocacy?
Well, we're seeing the direction from Chiefs and Assembly that was really clear from the December meeting, which was Canada, don't appeal the Jordan's Principle orders and address all these matters that the tribunal has ordered you to do. And we also have now the National Children's Chiefs Commission, which has been established, and that's a representative of each of the regions have appointed a chief to address matters like Jordan's Principle. And we're seeing increasing collaboration between AFN and the National Children's Chiefs Commission, and we're really happy to see that, and we're hoping that sorts itself out very quickly.
Right, and if you watch the news, of course, and I'm sure you do, there's a pretty current unstable political climate here in Canada. Their Prime Minister is going to be resigning. There's a Liberal leadership race, and of course, most of the media in the airwaves is sort of about the the Trump tariff threats, for lack of a better word. Is this affecting sort of some of the broader issues here of processing Jordan's Principle requests and actually addressing this urgent backlog?
Yeah, it's taking up a lot of oxygen. And you know what, like that kind of bullying kind of tactic that we see there south of the border really needs to have a more strategic response. I was really pleased to see the clarity of the Prime Minister's response with that in dealing with it. And hopefully, we get back to basics, because the best defeat of that kind of anti-human rights, chaotic leadership is to actually follow the law, do things in a principled basis aligned with human rights. And that's what we want this government to model for the United States.
Now, of course, there's been a lot of talk about a government change. If you look at the polls, Conservatives have a healthy lead. Of course, they're going to be changing Liberal leaders, so who knows what will happen with that and who the next Prime Minister will be and when an election will be, but it will be fairly soon. If there is a change in government and the success that your organization has had with bringing some of these matters to the Canadian Human Rights Tribunal, is there fears that their future could be in danger in terms of funding or their ability to make decisions on some of these key issues if there is a government change?
Well, the good thing about legal orders is they're binding across government. So we should see all governments hold up the law and discharge their responsibilities that way.
Right. So there's not, basically it will be, the Canadian Human Rights Tribunal will continue to exist. I guess there could be some changes in funding maybe, though?
Could be some changes in funding, but that's why legal orders are helpful. That's why we have the kind of division of powers, is to try those, even if the tribunal were to go away, for example, for whatever reason, the legal orders remain and could be enforced.
All right, well, we'll have to end it there for time purposes, but as always, thanks for joining us today.
Thanks for having me.
Up next, we'll talk to Nunavut NDP MP Lori Idlout about why she's raising alarm bells about the Inuit Child First Initiative. Welcome back. Nunavut NDP MP Lori Idlout has been raising alarm bells recently about the Inuit Child First Initiative. In a letter to Nunavut mayors this week, Idlout expresses concerns about the program sunsetting at the end of March, and numerous inquiries to Liberal government ministers about what is going on with the initiative that have been met with little response. Lori Idlout joins me today. Welcome back to Nation to Nation.
Thank you, Fraser, for having me.
All right, so I'd first start asking you, I guess, if you can briefly tell our viewers what the Inuit First Child Initiative does and why the NDP believes its funding will be coming to an end at the end of March.
Yes, it's such an important program. It's basically an equivalent of the Jordan's Principle, where First Nations has the Jordan's Principle. Inuit, because we are a different nation, the Liberals created the Inuit Child First Initiative to serve a similar function as what First Nations get under the Jordan's Principle.
Okay, and then how about the sunsetting or the funding coming to the end of March? How did you find out about that, or what led the NDP to believe that was happening?
Yes, we had seen that some months ago, which is why we started asking questions right away about what the Liberal government would do, given how important the program is. as I mentioned, with the ICFI being an equivalent to Jordan's principle, it's meeting very critical needs for Inuit families. Most Inuit families are forced to live in poverty, so ending this program would be devastating for those families that rely on it. So that's why as soon as I found out that it was sunsetting, I started trying to get answers from the Liberals about what they would do to replace it.
Now, yes, if you refresh my memory, I think there was a number of programs the NDP had looked at, and this had come up around August. Is that correct? And they had started to pressure the government on it?
Yes, absolutely.
Okay, so you refresh my memory. Now, it sounds like you list in this letter all the sort of times you approached sort of the three ministers that cover this area, so Northern Affairs, Crown Indigenous Relations, and Indigenous Services Canada, and also brought it up in the INAN committee. But what sort of a response have you got, or it doesn't sound like you've gotten very far?
Very limited response. Unfortunately, the most informed response was when they told, one of the ministers told me that they were working very vaguely, saying Inuit partners on a replacement. They wouldn't identify who these Inuit partners are and what they were negotiating with them.
And also, obviously, there's some gaps that we're talking about here, and then obviously you've been receiving feedback from your constituents. What have, I guess, some of the obviously you've been in contact with the mayors and municipalities, but even what are you hearing back from some of the families in your constituency?
Yes, everyone has been impacted by this program, meaning because there's such a high rate of poverty, that there are so many health issues in Nunavut, that there's a high percentage of people that are using it. And because of the positive impacts that it's having on people's well-being and on their health, they're quite scared about what's going to happen if this funding ceases to exist.
Now, of course, the Parliament was prorogued just earlier in January, and of course it will be a brand new session, and that will not happen until the end of March. But it sounds like this is kind of getting to a critical time. Is there still time, or what happens now? Because it is getting to, March. The end of March is not far off.
Yes, it really is unfortunate that the Liberals continually choose to delay in their responses. I think that they still have tools that they can use to at least extend the program to make sure that Nunavummiut can feel secure in knowing that there'll be supports for them. And I think that we have to keep pressuring them to make sure that they could guarantee that supports will keep going.
Now, you mentioned that this is a similar program to Jordan's Principle. We've done numerous stories on that, and it's sort of coming to recently the Canadian Human Rights Tribunal last fall. So is the problem with this program that requests just aren't being processed and they're getting backlogged, or they just don't have the money, or what really is the problem here with this particular program?
I think there are numerous issues with the program. I think, first of all, that the federal government is the main administrator of the program is a major one. I think that when they partner with municipalities, with organizations like Manitoba Inuit Association and the Arctic Children and Youth Foundation, those partnerships are what shows the success of the program. When there's been delays that we've heard of over the last year or two, we've also heard about, because of all these delays, that there have been lapses in funding in the millions that should have been used to make sure that Inuit and First Nations are getting the care that they deserve. There are not, I think that for Indigenous Services Canada to not meet the needs includes not having enough support staff or not having enough working relationships with First Nations and Inuit to ensure that it's Inuit and First Nations are the ones that are delivering programs, because they are the ones who know the people that they serve even better than what the federal government does.
And just as a follow-up to that, is it, I know with Jordan's Principle, there's supposed to be a 24-hour line that people can phone. Not always successful with that and getting, requests met. Is that similar with this program too? Is that people are supposed to be able to just phone directly and get get these requests through right away?
I know that in Nunavut, for example, there is an agency called the Arctic Children and Youth Foundation that have been trying to help with those kinds of immediate responses. I'm not sure about Inuit in other regions of Canada. Like, for example, I received a letter from the Manitoba Inuit Association, which serves Inuit in Manitoba, who also have been administering this program. And I'm not sure how it works there, but while there are minor differences, it will definitely be more effective when it's Inuit that are answering the calls.
Okay, well, I think I better let you get off to all your other interviews, because there seems to be a lot of interest in this today. So thanks for joining us and telling us about the latest on this program.
Fraser for having me.
Up next, we'll talk to Senator Patrick Brazo about his private member's bill to place cancer warning labels on alcohol products. Welcome back. Algonquin Senator Patrick Brazo has been advocating for years to put labels on alcohol products that warn of the risks of cancer. His private member's bill S-254 would make such warning labels mandatory. However, he has faced considerable pushback or indifference from industry, government, and other politicians. Senator Brazo joins me today in studio. So welcome back to Nation to Nation.
Thanks for having me.
All right, so as we were talking on the warm-up, tell me a little bit about this big symposium you had online just earlier this week about this issue.
Sure. So yesterday was World Cancer Day, and so part of that day, for the first time ever, I brought together parliamentarians, health ministers, brought other health experts, advocates, and people with lived experience on what we call the truth about alcohol. And so we had a day-long symposium of world-class experts and presenters talking to us about the negative impacts of alcohol, including the 7 fatal cancers that alcohol consumption brings, including a $6 billion alcohol deficit that Canada has. And so it was a very successful day. There was a participation from about 12 countries worldwide as well. And so this issue is gaining, slowly gaining momentum, and we're starting to see that with participation, and especially with the feedback that we've been receiving with respect to our bill.
Now, it seems to be, you've said, and everyone knows the risks of smoking, I think, and that's really been sort of pounded into the public conscious, but not so much maybe on alcohol, I guess, that people know some of of heavy drinking, things like that, or prolonged period of time, probably your liver, but cancer seems to be, have you found that that's not really something that people really are aware of?
Well, as a matter of fact, they're not aware of it because even myself, when I quit drinking almost 5 years ago now, when I started doing my own research about the negative impacts of alcohol, well, I found myself to be in the 75% category of Canadians that were not aware that there was a causal link between alcohol consumption and 7 fatal cancers. And so this is why I introduced this bill, so that we put warning labels on all alcoholic products, just like we do with tobacco products. And so I'm not trying to reinvent the wheel here, but it's about providing information, very important, vital health information to all Canadian citizens. And what better way than to do that with than having cancer warning labels?
Now, I know that my colleague Mark Blackburn, of course, he interviewed you, and he did quite an extensive story on this, and he interviewed Judy Washer-Lees, who was an NDP politician and tried to bring this up about 25 years ago. I guess it would be surprising to some that it's been so hard to get these warning labels on, but you certainly have met a lot of resistance in trying to tackle this issue, it sounds.
Well, I wouldn't say I've been met with a lot of resistance, but having said that, it doesn't mean that I've been receiving support from the current government, for example. As a matter of fact, I've met with the health minister very briefly. I've met with the former Minister of Mental Health and Addictions, Carolyn Bennett, and the current minister, And it doesn't seem that there's an appetite to have these warning labels. And as a matter of fact, they're more talking along the lines of what we hear from the alcohol industry. And let's face it, the alcohol industry, they don't want cancer warning labels on their products because they know that's going to reduce their sales. And so they are doing everything that they can at the political level to ensure that these warning labels don't see the light of day. But as time goes on and as more Canadians are educated about the negative impacts of alcohol, well, I'm going to say a safe bet here and say it's no longer a question of if we will have cancer warning labels, it's a question of when. And obviously my office is working very hard to ensuring that takes place.
Now, of course, you've been very public about your struggles with substance abuse and where that's led you. It's not uncommon at the political level, as you know, the stresses and everything. Lots of politicians deal with this. They take some time off. I think what's different about you is you've been not only very public about it, you've tried to make some change. So what was it that after you had dealt with your personal struggles that made you really want to be so public about that? I mean, it must not be easy. And also make that a big part of why you're in politics is to get some of these warning labels on products.
Oh, sure. So, once I went through what I went through, I was a senator before. I was always interested in politics, and I was always interested in politics to try and do something. And so for many years I was in search of what issue I could bring forward. And unfortunately or fortunately, at the same time, I went through what I went through, and it kind of brought me to a very deep and dark and lonely place, and it almost didn't end very well for me at one point. But miraculously, I found the strength to climb my way out of it slowly, one day at a time, and it's still one day at a time today. But it was to find that energy to try and give back, and not just give back, but to share the information that I had just found out in being in the 75% of category of Canadians that wasn't aware about the causal link between alcohol consumption and 7 fatal cancers. And so my mom died of lung cancer in 2004 because of cigarette smoking, and so I had told her on her deathbed that I would try to do anything that I could to fight cancer. And this is why I'm doing this, and it's why I got in the ring with the current Prime Minister to raise money for cancer research. And so having said that, I'm always ready for a rematch at the same time. And so all the current Prime Minister has to say is yes, let's do it again. I'm ready for this rematch, because at the end it's all a fight against cancer. And that's my fight. That's the fight that I chose, or perhaps it chose me. But either way, I'm moving forward with this, and I'm moving forward because every Canadian citizen has the right to know this vital health information, and that's what keeps me going every day to try and achieve just that.
Okay, well, thanks very much for joining us today, Senator Barrasso, about a very obviously serious issue, and then one that the public certainly doesn't know enough about, so I really appreciate it.
Well, I thank you for your time, because it's also important for Indigenous peoples, and a lot of Indigenous peoples hurting and turning to substances like I did to try and kill that pain. And so it's important that for those struggling, if they can, call a friend, call a family member, call a stranger, call anybody, ask for help. It's not a sign of weakness, it's a sign of strength.
Yes, absolutely. Well, thanks again. That concludes this week's episode of Nation Nation. If you missed any part of tonight's show, you can check out our podcast at aptnnews.ca/podcast. I'm Fraser Needham. Good night.